Hello, everyone. I'm Michael Jarr, Senior Vice President at the Badger Institute, and I would like to welcome you to our podcast, Free Exchange. Thank you for tuning in. We're in for a treat today. We're going to discuss an issue that affects millions of Wisconsinites, a rare issue that actually enjoys broad bipartisan support, and why efforts to address it have hit a brick wall. We have two terrific guests who know the issue well and can explain why it's critical to the health and well-being of our most vulnerable residents. Our first guest is Grover Norquist, founder and president of Americans for Tax Reform in Washington, D.C. Americans for Tax Reform works to limit the size and scope of government, opposes higher taxes at all levels, and supports meaningful tax reform. Grover holds an MBA and a BA in economics, both from Harvard University, and somehow he has still managed to emerge a supporter of free markets. Our second guest is Matt Crespin, Executive Director of the Children's Health Alliance of Wisconsin, where he oversees its initiatives and leads efforts to build partnerships with public and private health systems, organizations, and individuals. Matt received a bachelor's degree in health sciences and dental hygiene from Marquette University and a master's in public health from A.T. Still University. Matt is a former president of the American Dental Hygienists Association. Welcome to you both.
Thank you.
Thank you. Great to be here.
So let me just quickly lay out the problem. Wisconsin suffers from a dental access shortage, particularly for children and families on Medicaid, rural residents, people with disabilities, veterans, and other vulnerable populations. Let me just give you a few stats that I think will set your teeth on edge, if you will. Wisconsin has one of the lowest rates of dental care in the nation. 20% of the state's residents, that's more than 1.2 million people, live in an area that has a shortage of dental health care professionals. Only 40% of children in families on Medicaid received preventative dental services in 2019, and only 1/3 of Wisconsin dentists accept Medicaid patients at all. More than 90% of Wisconsin's 72 counties have at least one geographical area that's designated as a dental health care provider shortage area. The good news, on top of all this bad news, is that there is a bill in the legislature that would address this crisis, and not by providing a government solution, but by offering a free market option that would benefit underserved populations and taxpayers alike. The bill would allow for dental therapy to be practiced in Wisconsin. Grover, this is an issue that you have written on and tracked and weighed in on over the years. Tell us, what is dental therapy and why is it a critical way to address problems like we're experiencing here in Wisconsin?
Well, when dentists or doctors or other professions organize, they tend to limit the number of people who provide that service in order to keep prices up. And that unfortunately also limits people's access to various medical experts, doctors, optometrists. And what's happened over time is people have realized, there's plenty to do. There's no good reason to set up this occupational licensing guild barrier to people coming into Wisconsin or other states and providing different levels of support. When you go to the doctor's office, you often see a nurse to begin with, and the nurse can do a whole bunch of things. The doctor could do them too. The doctor just costs 2, 3, 4, or 5 times as much per hour as a nurse, and then there are different levels of nurses. And the same thing can and should be available with optometrists and with dentists, where you can have people at different skill levels that they come in and they cost less, and a dentist could have several working with or for him or her, and make it possible to get more people with their teeth cleaned and checked for cavities and all the things that you need to do for dentists. Not everybody needs to fill crowns or reconstruct your bones in your face. So this gives us a real opportunity to get more people the basics on dental work. But again, it's not just dentists. This has been going on with all sorts of people who make eyeglasses, people who in medicine, where you get more people into the business, it reduces costs. And you also at the same time, you can say to dentists and to doctors and to ophthalmologists and so on, there's plenty of work to be done. And let's get everybody in the state the kind of healthcare they need at a reasonable cost.
So this is a similar situation to many years ago when there were efforts to allow physicians' assistants to practice alongside of physicians. They don't have the same high level of educational requirements, but they are still equipped to do a lot of these mid-level things. Nurse practitioners are another example. And initially, physicians were opposed to those being created and allowed to practice in various states. Now they're commonplace. Now almost every mid-level or even small practices have physician's assistants or nurse practitioners and so on. Dental therapists would be that same kind of a mid-level position here in Wisconsin, but there's no mechanism for them to practice here in the state. And so this legislation would actually create an ability for dental therapists to practice in Wisconsin, to join existing practices with the oversight by a dentist, to go ahead and do that. Matt, is that a good definition of what's going on here?
Yeah, I would say so. And I would say, dental therapists ultimately are trained to do all of the different services that they're going to provide. And they do so at an accredited university or technical college that has a training and education program. There are accreditation standards for dental therapy, just like there are for other professions, dental hygiene, dentistry, and the like. And they're very well trained professionals that are highly educated in serving the population in a very, very safe and effective way.
So what would they do that dentists wouldn't have to do?
Well, a good example I can give you is our organization, Children's Health Alliance of Wisconsin, partners with the Department of Health Services to provide school-based dental services, primarily preventive services where we come in, examine children's teeth, provide preventive care like sealants and fluoride treatments. But about 40% of those patients that we see have some sort of dental disease that we aren't able to treat on site because we don't have a dentist there. So we spend an immense amount of time trying to coordinate care, getting those patients into a dental office, which is challenging, as you noted, because of whether it's they live in a rural part of the state where there's not a lot of providers, or whether they live in an area of the community where it's hard to find a Medicaid provider. And dental therapists could fill a huge void for the dental practice in being able to see those patients right at school using portable dental equipment, or as a member of a dental team at a dental office where they might be doing a filling that you would come in for. You have a cavity and that dental therapist is trained and able to do that filling. It allows the dentist, it frees up their time to do much more complex procedures, surgeries, things that a dental therapist isn't trained to do. It really maximizes the workforce within the team. And really allows everybody to practice at the top of their scope and the top of their license.
So we have an issue basically with Medicaid. A lot of dentists, a majority of dentists in the state do not accept Medicaid because the reimbursements are very low. And that means that particularly vulnerable and underserved populations are not able to get access, at least not locally, to good oral care. Grover, wouldn't it make just sense to raise the reimbursement rates for dentists, and wouldn't that just make the problem go away?
Well, there's a limited number of dentists because there are a limited number of dental schools, which is on purpose. And all that would do is funnel more money into the same amount of work. What you want to do is get more people to have access. And again, not everybody needs to see a dentist or a doctor. Nurses can do a lot of things, give shots and so on. And working together, you can do triage. How much expertise does each patient need? And at different times, it's a different question. So we just want to make sure that people get to start with make sure that their teeth are healthy and not falling apart. And then we can get into more difficult crowns and expense fillings and so on that may take more expertise. But let's get basic care to more people at a lower cost, and to give people who may not have the time to go to dental school, but who can learn how to do very helpful things for people's health in terms of their teeth, and to get that available to people. That you want to, the goal is not to, you could always throw more money at it. The problem is if there's a blockage in the number of people doing something, you can throw more money at it. You're just paying the same people more money for the same amount of work. That doesn't get you more care. It gets you more expensive care. And over time, maybe someone will start a new dental school, but what's the lag time for that? Your kids will have graduated from college.
And Matt, you mentioned, I think it's called the Seal a Smile program that actually is treating 70,000 students across Wisconsin in 1,100 different schools. Why is it so important to get good oral care? I mean, it's not just about just having healthy gums or getting a tooth filled. It really extends the impact of not having good oral care, expands into a lot of other areas.
Yeah, I mean, it's really critical, and I think it's something that many people take for granted. I mean, I think, if I wake up one morning and I have a toothache, I have private dental insurance, and I have the means to call up a dentist and make an appointment and likely get in that day and have the issue resolved, and I'm back to work and functioning. If you have a young child, say, for example, in kindergarten, first or second grade, really those critical years where their brain is developing and they're learning some really critical things, if they're sitting in school with pain in their mouth, they're not able to eat properly, their nutrition is poor, they're not able to concentrate in school, it's certainly going to impact outcomes. And there are instances of dental disease that does progress into some very complex and detrimental things. There was a 12-year-old boy in Maryland who passed away due to an abscess that spread to his brain, had $750,000 worth of brain surgery, and unfortunately passed away from a preventable dental disease that likely could be treated right in a dental office, likely by a dental therapist, in fact. That early intervention and getting that decay early is critical so that it doesn't continue to spread, get bigger, get into your bloodstream, into your heart, lungs, and brain.
And then you also end up with kids having malnutrition because they're not eating. If they've got a painful tooth, you've got people who are being treated in the ER instead of by a trained, dental expert, which means that often people are being sent home with perhaps painkillers, opioids, and so on. So it's just and the ER costs are just passed on to everyone else, and so it's just not ideal on any level.
Yeah, you talk about cost to provide care and what this leads to. I was speaking to a health system executive, and he shared that they have probably upwards of 30, 35 cases a year of people that come into their emergency department with a toothache. And the toothache or abscess is so severe that they don't feel comfortable discharging the patient, and they need to use some sort of IV antibiotics to help get this under control. And in some cases, they have to admit these patients or transport them to another location. So when you think about the cost that includes, that is passed on, that is just immense and quite frankly preventable, it just makes total sense to allow providers to do what they're trained to do, allow providers to work at the top of their scope, and not put barriers in place to prevent that from happening. And we've seen success in Minnesota. There are now more than 100 dental therapists practicing in Minnesota. And oftentimes there's concerns that these dental therapists are only going to congregate in urban areas and work in the metro area and work at high-end dental practices and not provide care to the underserved. But in Minnesota, the dental therapists are fairly distributed well, similar to the way the population is distributed. So about 60% of the dental therapists practice in the metro areas of Minnesota, and about 40% practice out in the rural parts of the state. Another common misconception is the types of practices that they'll end up working in. In Minnesota, recent data from as recent as March shows that about 40% of dental therapists, which is the largest percentage of them, are working in private practice offices. So the office that you might go to that has one or two dentists down the street from your house, that is where dental therapists are practicing, and it's allowing practices to increase the patients that they see that are enrolled in Medicaid, but also dental therapists are seeing patients in general. Just like we see nurse practitioners and PAs when we go to the office, we often don't see the doctor if we have an issue. We see the person that's best suited to provide that care. In addition to that, 37% of them that work in private practices, about 26% work for community clinics or community organizations. 20% work for large practices like your DSOs, and about 10% work for federally qualified health centers. So they're pretty well distributed amongst the different care delivery models within dentistry.
Michael, one of the advantages here is that Wisconsin would not be the first state to have done this. We can look at other medical areas, doctors and optometrists and so on, where you see various levels of talent and expertise required that have come in. But we've actually seen this now in dental therapists in next door, Minnesota. You can get in a car and go drive and see, that it's working and that it's doing exactly what people expected it to do. Washington State as well. Another 7 other states have legalized it. I don't know what their status is in terms of how many they've got up and running, but this is something that's going state by state. And one of the advantages for Wisconsin is to be an early adapter. I guess it's never exactly fun to be the first guy in, because you bop around and you say, "Oh, that didn't work." But here's what we're finding out. There isn't some big problem that somebody could imagine, the things that people suggested. I don't know, this might happen. Well, let's look. Did it happen in Minnesota or Washington? I mean, you could reason to it because we've seen it with doctors and registered nurses and various kinds of level of nurses and doctors in other areas. Which you could go, that makes so much sense as to how it would work. But it's even better to be able to say, here's a real live, you can poke him, and he's there and he's alive and he does things. And you can ask him questions or her questions about how it works. You can talk to patients. So by being, one of the top 10 to get it done, you're early enough. You don't want to be the last guy to do it, because then it's really clear that everybody whose teeth are falling out and everybody who has bad health problems will think, your fault, legislator, your fault, state government, for why didn't you see what was going on around you? But right now, Minnesota's right next door. Washington State's not that far away. You can fly over there, go say hi. Call. We got phones and everything. You can call, Zoom. So this is why it makes so much sense to move. That it's not just. I mean, I think you can reason to why this makes sense by looking at what happens with doctors and nurses, but beyond that, you can actually see it happen and be able to talk to people about how it happens and how much better it is in terms of cost and availability. And I think the more dental therapists we have, you can dramatically increase the health of all the kids, everybody, rich, poor, middle, suburban, rural, everybody. I lived in big cities. People have pretty rotten teeth in big cities. It's not just the rural areas that can have these problems. I worked in North Carolina with folks, and they had the third fewest dentists and the third highest costs and something like the third worst outcomes. There just weren't enough people being dentists or helping dentists to get costs down and to get quality out there. So this is one way to get that done. And it empowers, I mean, wouldn't you, if you were a dentist, like to have 2 or 3 people working with you? I mean, that's small businessmen like staff because you can do more. People in restaurants, the cook doesn't also want to be the guy who puts out the plates and the busboy. There are lots of different jobs in anything that's as complicated as dentistry. It shouldn't surprise us when you go to a store, you don't ask to see the CEO. I know I could only talk to the head of General Motors to buy my car. Well, actually, there are other people who know lots about cars. Not the CEO, not the guy who built it. And he's in, I started to say Detroit. Now he's in Alabama somewhere. But so it shouldn't surprise us that Adam Smith's idea that when you can take different pieces of a job and divide it into different areas, you can be much more effective, cut costs, and get more. That doesn't mean the dentist makes less. He gets to see more people, and the dental therapists get to see and serve more people and get it done. You make money, it's not like these guys are going to go broke or something, but you get more done, and that just got to make everybody feel good at the end of the day.
Yeah, spot on.
Yeah, I mean, there's models in Minnesota that have shown that both the DSO model and private practice models generate more revenue for the practice and increase the number of patients that the office is seeing. So in that sense, it really is a no-brainer. And you used the analogy that you shared, and I've heard another one in regards to dental therapists, is if you have a heart attack or you have an accident, the heart surgeon, or any surgeon for that matter, isn't on board that ambulance when you get to the scene. Someone else who's very highly trained, highly educated in a specialized field, his job is to keep you alive so that you can then get to whatever care it is that you need, and really they can triage you in the best way possible. So this isn't intended to replace dentists. It's really meant to complement dentistry and allow dentists to provide more valuable services that only they are trained to provide, and allow others who are also trained to provide a service to be able to do so in an efficient way.
Yeah, I was just looking recently at the Pew Charitable Trust's list of states that have authorized dental therapy in some form. Some are statewide, some are taking place in tribal areas, but there are now a total of 13 states that have authorized dental therapy in some way, shape, or form. One is Michigan, has just more recently done it. Minnesota is really the leader on this. They've got 10 or 11 or 12 years now under their belt of experience. And it's interesting, when Minnesota first passed the legislation that allowed for dental therapists, 80% of dentists were opposed to expanding or creating that practice. What we're seeing now is that 60 to 70% of dentists in Minnesota not only support the change, but demand is so high that many of the dental therapists in Minnesota actually secure jobs before they even graduate. And some people say, well, even if you got this going here in Wisconsin, it'll be a long time before, Wisconsinites go through the school and get credentialed and so on and so forth before they can really begin to have an impact. But we've talked to at least a couple of different Wisconsinites who have gone to Minnesota, become dental therapists and are practicing there, but they'd love to come back to Wisconsin and practice here. So the minute we allowed for dental therapy to be practiced in this state, I expect we would have at least a handful of people who would come back across the border and begin to help address these issues and these shortages that we have here.
And the idea that there's a lag because if you made something legal, it would take time for some people to get trained and so on, is an argument for doing it 2 years ago.
Right,
Not an
exactly.
argument for not
5
doing
years
it.
ago. Right,
Yeah.
Exactly. So the challenge that we have here is really not that we have opposition from the dentists. It's not that this is a partisan issue. We have a bill that would create dental therapy that sailed through the Senate with bipartisan unanimous support. In the Assembly, there's broad support on both sides of the aisle. They probably would pass it tomorrow if it was brought to the floor. The governor would sign this bill. I'm fairly certain. He's indicated that, and he's had similar measure in his own budget. So it really comes down to the fact that Speaker Robin Vos in the Assembly has assigned this bill to a committee that basically doesn't hear or address legislation. So effectively, it's in limbo. And he hasn't publicly given a reason for why that's where he's sent it. But I know that the organizations and the bill sponsors and supporters are really hoping that in this coming session in January, February of March of 2022, that dental therapy can be gotten across the line, and Wisconsin can really begin to ramp up and address the significant shortage that we have. Matt, tell me a little bit about some of the organizations, including yours, that are supporting this measure.
Yeah, I mean, I think, as you mentioned, it's significant. I think that it has bipartisan support and passed the Senate unanimously. I mean, I don't know how many bills can say that in this session or in the last 5 years or in this day and age. It's just not something that you see. And I think it's a bill that has a lot of meaning behind it and can get some things done. A variety of health systems from around the state are supportive of this. Many of the federally qualified health centers, organizations like the Badger Institute, Disability Service Provider Network, the Wisconsin chapter of the American Academy of Pediatrics. So you have medical professionals, the Wisconsin Public Health Association, the Wisconsin Public Health Association's local boards of public health. So you just have a whole lot of support for this bill from a pretty broad spectrum of supporters, not just the dental community, not just FQHCs that provide dental care, but health systems that are seeing patients in their emergency rooms and operating rooms, from disability rights groups who struggle to find access to care for patients that they work with, and advocacy groups that see the benefit for this for a variety of different reasons, whether it increases access or provides a better opportunity for a free market. It's a win in all cases.
Mm-hmm. Yeah, groups, I've seen groups testifying, ranging from the AARP to Children's Hospital, disability groups, veterans groups. It really brings together a broad array of organizations statewide that say, we desperately need this. We really need to make this happen in Wisconsin. I've never seen quite such an eclectic collection of groups getting behind a bill before. Matt, you've got a Wisconsin perspective, and Grover, you've been in the political realm for quite a while. What if you're a listener and you are concerned about this and want to make your voice heard, what should you do?
I'd say talk to your state legislator, to your state representative, and look, whether it's a leader or a member, they've all got hundreds of things technically on their plate, and you're not just competing to be a good idea. There are lots of good ideas, but only so many good ideas are going to get passed into law in any given year. And so you are competing against other good ideas that people are working on. And so you just need to have the members understand that there's enough people calling, writing, coming to visit, making the point, either wearing their own personal hat, their own personal experience, or organizationally. Speaking to this issue, if you go to a Rotary Club or the equivalent, just mention it to the whole group. The more people are talking, here's a good idea that reduces the cost of healthcare without spending more money or taxpayer money or pushing people around. Just it expands freedom and more people to get to do stuff. And by the way, they've done it in other states and it's worked. So it's not, it's always the guy who shows up at these meetings who has an idea it's going to solve everything. And so there's a tax increase in the middle of it somewhere. Right. Or it's never been done before, but we're sure going to have fun trying. So to make the point, this has been done in other states. This has been done in other kinds of medicine in the medical world. And the more, and it's not a tax increase, it's not a spending increase, it's more things done for less money per person, to make everything more efficient and effective. I think take an opportunity, talk to people in your church, synagogue, mosque, let them know there's this interesting idea. People hear something enough times and they feel comfortable, they'll repeat it. You want state legislators, state legislative leaders, people in the press to have heard about this repeatedly. It's easy to just talk directly to a congressman or state legislator. They kind of discount that a little bit because everybody's yelling in their ear. But if you talk to enough different people, then the legislator will hear it in different capacities, in different ways. Radio talk shows that if you can bring this up, one way to keep costs down, not raise taxes, is this sort of reform. This is the kind of reform that allows you to do more with less tax dollars, fewer tax dollars.
Absolutely. Matt, any thoughts?
Yeah, I would agree with everything Grover just shared. I mean, I think talking to your neighbors about this and why it's important, you never know who you're going to talk to that might have a connection with a state legislator, maybe went to school with them, lives around the block from them, their grandma lives next door, you never know. But I mean, I think just sharing that it's been done. This isn't something new. It's been done in other countries for over 100 years. Many countries, it is the standard of care. And I think at some point maybe in our lifetimes, it will be here. I think it's not a matter of if it's going to happen, it's when it's going to happen. And the states are ticking off. I mean, Washington, Arizona, the list keeps growing, and it's time that Wisconsin become part of that list and move forward with that.
Absolutely. Well, gentlemen, thank you again for weighing in on this really critical subject. It's important. We're very close to the finish line. There's a lot of good reasons to do it and a lot of support behind it. So we really appreciate your coming in and talking with us. And if for our listeners, if you're interested in learning more about dental therapy, please visit our website, badgerinstitute.org. We have a whole page of resources. From talking points to research papers to articles and videos related to dental therapy and the impact that it can have here in Wisconsin. So check us out again, www.badgerinstitute.org. Thanks again, guys. Thanks for listening, and don't forget to floss.
Thank you.
Thank you, Michael.